The hypodermic needle is one of those inventions that almost everyone recognizes, yet few people stop to think about where it came from. Today, it is an essential part of modern medicine, helping doctors deliver vaccines, medications, and other treatments with remarkable precision. Although many people associate needles with discomfort, their invention marked one of the greatest advances in medical history. Before they existed, delivering medicine directly into the body was difficult, unreliable, and often impossible. The story of the hypodermic needle is not about a single inventor. Instead, it is the result of centuries of experimentation, scientific curiosity, and the search for better ways to treat disease. Right here, on History of Simple Things. Long before the hypodermic needle existed, physicians understood that medicines could enter the body in different ways. Ancient Egyptians, Greeks, Indians, and Chinese healers relied on herbs that were swallowed, applied to the skin, or inhaled. While these methods often worked, they were not always effective because many medicines weakened before reaching the areas where they were needed. Some early civilizations experimented with hollow tubes made from animal bones or bird feathers to introduce liquids into the body. These crude devices were mainly used for cleaning wounds rather than injecting medicine. Even so, they revealed an early understanding that placing substances directly inside the body could produce stronger effects. During the Renaissance, growing knowledge of human anatomy inspired physicians to imagine new ways of delivering medicine, but the necessary tools had not yet been developed. A major turning point came in the 17th century when English physician William Harvey explained how blood circulates through the body. His discovery showed that if medicine could enter the bloodstream, it might spread much more efficiently than medicines taken by mouth. Inspired by this idea, scientists began experimenting with injecting liquids into animals. One of the earliest was Sir Christopher Wren, who used hollow goose quills connected to animal bladders to inject substances such as wine, opium, and medicinal extracts into dogs. Although these experiments proved that injection was possible, the equipment was fragile and impractical for treating patients. Even so, they established the scientific foundation for future inventors. The true breakthrough came during the 19th century as advances in metalworking and glassmaking made more precise medical instruments possible. In 1853, Scottish physician Alexander Wood created one of the first practical hypodermic syringes fitted with a fine hollow needle. His design allowed medicines like morphine to be injected beneath the skin with far greater accuracy. Around the same time, French surgeon Charles Gabriel Prévaz independently developed a similar syringe for surgical procedures involving blood vessels. Although they worked separately, both inventors made lasting contributions to the modern hypodermic syringe. The word hypodermic comes from Greek words meaning under the skin, describing exactly how the needle delivers medicine. As hypodermic needles became more common, doctors quickly recognized both their benefits and their risks. Early needles and glass syringes were reusable, making careful sterilization essential. If they were not cleaned properly, dangerous infections could spread from one patient to another. The acceptance of germ theory and the work of scientists such as Louis Pasteur and Joseph Lister encouraged much stricter hygiene practices. Sterilization became standard, making injection significantly safer. At the same time, manufacturers produced thinner, sharper, and stronger steel needles. Different sizes allowed doctors to inject medicines into veins, muscles, or beneath the skin depending on the treatment required. For many years, hospitals continued using reusable syringes despite improvements in sterilization. However, cleaning every instrument perfectly remained time-consuming and carried some risk of contamination. During the mid-20th century, disposable plastic syringes and single-use stainless steel needles transformed healthcare. These sterile devices could be used once and safely discarded, greatly reducing the spread of infectious diseases. Disposable needles also made large vaccination campaigns more efficient and helped millions of people with chronic illnesses such as diabetes safely administer medications at home. Today, needles continue to become thinner and more comfortable while maintaining their reliability. The hypodermic needle has influenced nearly every area of modern medicine. It has made blood transfusions, intravenous treatments, advanced surgeries, laboratory testing, and countless medical procedures possible. Many life-saving therapies simply could not exist without accurate injections. Its importance became especially clear during worldwide vaccination programs, where billions of injections helped protect people from infectious diseases. It has also become an essential tool in emergency medicine, where medications often need to be delivered as quickly as possible. Researchers are now developing alternatives such as micro-needle patches and needle-free injectors, but the traditional hypodermic needle remains one of medicine's most dependable tools. More than a century and a half after its invention, its basic design has changed very little because it continues to perform its purpose with remarkable effectiveness. The origins of the hypodermic needle show that medical progress is built through generations of discovery. From ancient healers experimenting with simple tubes to 19th-century physicians creating precision instruments, each step brought medicine closer to the reliable injections used today. Although it is often associated with discomfort, the hypodermic needle represents something far greater. It has saved lives, prevented disease, relieved pain, and made countless modern treatments possible. Its history is a reminder that even a small medical tool can have an extraordinary impact on human health. Thank you for watching. If you have suggestions for our next video, feel free to share them in the comments below. We'll be sure to give you an acknowledgement for your contribution. Thank you for joining us on this journey through the history of simple things. Don't forget to like, subscribe, and stay tuned for more stories woven through the smallest details.